6-year-old child presents with recurrent jaundice. Between the episodes, he is totally fine and his growth is satisfactory. Mother gives history of jaundice being brought by infections. What is the most likely diagnosis? G6PD is a membrane defect with enzyme and can have hemolysis whenever there is infection. Spherocytosis and sickle cell has very slow hemolysis and can have a tinge of jaundice but not episodic. Thalassemia patients require regular blood transfusions and can get iron overload. Child with a history of asthma is brought to ED with a cut to the knee and a sprain to the left wrist, which is the best analgesic for her. I think the hint here is asthma, that you should not give NSAID, like ibuprofen cannot be given for asthma as it can trigger a wheeze. Opiates are not necessary for this child. First you have to give adequate dose of paracetamol. 15-month baby girl presents to the ED with difficulty in breathing. Examination shows intercostal recessions and fine inspiratory crackles. What is the most likely diagnosis? So bronchiolitis happens in infants and up to 2 years age, which is a viral illness, most likely secondary to respiratory syncytial virus. URTI will not have crackles. Pneumonia will have focal signs. RDS is a disease of newborn babies, and alpha-1 antitrypsin can have chronic chest symptoms. This is episodic for the last few days only. Mother brings 14-month-old child who holds furniture and other things to help him stand and walk. He can say mama and papa. He makes eye contact and smiles. He can transfer objects from one hand to another, responds to his name. What is the interpretation of his development? His milestones are normal in all domains, as expected for a 14-month-old child. 5-year-old child is being investigated for TB as father is recently diagnosed as open case of TB. His parents don't agree for taking a bronchoalveolar lavage sample. What other sample can be taken for diagnostic culture? Again, it's an unusual question. The answer is gastric washing. Small children, if they have pulmonary TB, they often cough and swallow the sputum. So early morning gastric washing can be taken for culture. You can leave an NG tube in situ and in the morning aspirate the NG tube or do a gastric washing and send that sample for culture. 2-week-old girl presents with E. coli UTI, which is confirmed by urinary culture, and she responds well to the antibiotic treatment within 48 hours. What is the most appropriate next investigation? As per NICE guidelines for practice in UK, this baby needs renal tract ultrasound within 6 weeks. Many units may choose to do an inpatient acute ultrasound, but that is not necessary. Invasive tests like IV urography or MCUG are not indicated if she responded well to the antibiotics in 48 hours, unless it was an atypical organism or if it was a recurrent UTI. 6-week baby has a blue mark near coccyx since birth. The mark has not changed since birth, but mother is worried. What would you do? It is very likely to be a Mongolian blue spot because the mark has not changed after birth. So this is not a hematoma, it is not a bruise. So you will not do any other tests. At birth, a baby boy at 38 weeks gestation weighs only 1.8 kilograms. He has hepatosplenomegaly and a rash. Blood tests show raised level of bilirubin and liver enzymes, what is the most likely diagnosis? So this is congenital viral hepatitis. Many viruses can affect the liver, and if the infection happens in late pregnancy, it will lead to IUGR, hepatosplenomegaly, and elevation of liver enzymes. Mother got infected with hepatitis B during pregnancy. Child is born and she is worried about risk of transmitting infection to the baby. How can you protect the baby? If it's a confirmed infection acquired during pregnancy, baby will need hepatitis B full vaccination 0, 1 and 12 months and hepatitis and immunoglobulin to protect the baby from vertical transmission. 10-year-old boy is brought to the ED 8 hours after the injury to his foot, which was punctured with a metal spike that passed through the shoe. What is the best next step? So there's no mention of his vaccinations being incomplete, so this child just needs cleaning the wound.